everybody. I'm discussing my experiences with the International Fellowship. Actually, I did my training, like post-graduation and senior residency from RP Center. And after that, I went for 3 month ICU fellowship. So, before jumping for any idea for international exposure, one should have a very clear objectives, what you want from a fellowship. And I'll discuss about the benefits and the timing for a fellowship. So the question is it really required international exposure or international fellowship? So actually, in India, actually I'm talking about the person who have well trained in the India, who have done the post-graduation, who have done the fellowship here in the India. After that, do we need a fellowship? Actually, in India, we are exposed to high volume. We see all the simple to the complex cases. We are quite competent and confident after the fellowship. But as we have discussed, that Indian fellowships are a bit less supervised and organized. In the Western countries, there is one-to-one supervision, and once you are competent in your field, this is the best opportunity to work under the stalwarts of the subspecialty. Here, a short-term international exposure give you interaction, knowledge sharing with the stalwarts. And which is the best place? Like we are well trained here, we know everything, so we should choose a place which can add on our experience. Like in my case, I was fortunate to work with New York Eye and Ear Infirmary, New York, which was the world's second oldest eye hospital. It was established in 1820 and having a huge surgical load. The benefits, there are several benefits, though I will discuss a few of them. First and the foremost is the clinical skill refinement. All the patients which come in the clinic are thoroughly discussed with the fellow, observer and the consultant. There is a one-to-one interaction. And meanwhile, all the previous medical records and the investigations are electronically recorded and it is just one click away. So a patient is there, you just see all the previous records and you discuss with the consultant. You see the natural course of the disease, the impact of the interventions. So it is, though the tenure is 3 months, but it adds your experience, it gives is a longitudinal experience for a particular patient. All the surgeries done by a fellow is directly supervised and many of them assisted by the consultant. So on the surgical table, I was able to listen and follow what they are communicating between us, between the patient and the fellows. Small surgical tips, tricks can only be learned in the operation theatre. Though they are stalwarts, they used to come in the conference, but in the conference we can't learn small surgical tips that can only be learned in the operation theatre when something gets fixed and we are trying help. So this is the only way of learning. And you also feel very actively involved. You are involved in the patient examination, pre-operative assessment and the surgical decision making. If you are already being well trained, you are in a better position to discuss with the consultant. You can share your experience, you can take their opinion, and it adds on your experience. If you are interested in research and academics, it is the best opportunity. They are very receptive. Most of the time they involve you in the ongoing research. Apart from that, working in a different healthcare system is a challenge. It reforms your fundamentals. The mannerism, the professionalism, the dedication towards the work, the interaction with the patient, the relatives, these are mind-blowing. Actually, I am highly impressed, and in a number of ways it has influenced my current practice. The insurance, coding, billing, though these are new things for me there, but within the 2 years I am realizing that it is influencing our medical practice here, and sooner this will dominate our medical practice, the insurance, coding, billing. This is also, I interacted with fellows of different countries. I asked them about their medical care system, and I realized that after completing the training back in India, I am much more experienced, I am much more confident and competent. Because in India we are exposed to so many of the variety and the medical system is far better. Though we criticize a lot, but believe me, the exposure and the training and the opportunities that we get back in India is unmatchable. It gives me a sense of pride to be an Indian. And it is a long-term relationship, like, the consultants there, the fellows there. Now in the era of the WhatsApp and the internet, you can always discuss your clinical scenarios and the problems. So it is like a long-term your association with the international faculties. And the more importantly, this international opportunities broadens your horizon. It changes your outlooks. If you're planning for the overseas jobs, it gives you a great opportunity. Like after the fellowship, I practiced in India, then at a certain point of time I moved to UAE, now I'm working in the Middle East, and this international fellowship definitely gave me an extra edge. So the question is, what is the appropriate timing? Because this getting an international fellowship is a time-consuming process. You have to plan early in the career. You have an option like a short-term observationship or long-term surgical fellowship. The ICO gives the best opportunity. Like as I did a 3-month observationship, but I did through the ICO. ICO is a very generous institution. They award you a fellowship. Though the 3 months, but you are awarded with a fellowship. And it could give you a decent amount of scholarship. So the question, as the Dr. Arora was saying, that during the SRship you don't have any tag of the fellowship. So you can get a tag here. This fellowship word impacts a lot. Actually, one step. Actually, ICO exams are done once in a year. So there are 3 steps. So practically it takes 3 years. You can combine 2 steps together. So I cleared first and second step during my post graduation. Is helped in my academics also. First step in the third step in the SRship. Then I planned and I did my SRship after completion of my training. So I think it was the best time before going to the private practice, and just completion of the training. A short-term international exposure makes a difference. If you are going for a long-term surgical fellowship, USMLE is the must. If you are looking for the United States, it's a tough job. But if once you are having a SF match, 1 or 2 international publication or original work give you a fair enough chances for a fellowship. And back in India, when I completed my fellowship, I felt myself more confident and competent. It gave me some early recognition among the peers, and specifically in the internet savvy patients. These days patients go to the practo, patients look for your CV, patients look for your articles, then come to you if you are working in Tier 1 cities. Wherever you practice, a corporate, individual practice or in academic institution, this fellowship, though 3 months, give you extra edge. So in conclusion, I say that 3 months or a short-term fellowship, if you get a word of fellowship, it is worth doing. It costs nothing. It gives you a scholarship, international exposure. It adds on your confidence. It is an extra feather in your cap. Thanks a lot.